Hello and welcome to today's episode of Personal Injury Today. I am your host, Brandi McMichael, sitting here with Dr. Brad Poppie as we talk about today's subject, the role of rehabilitation doctors in a personal injury case. Thank you so much for being here, Dr. Poppie.
Thanks for having me.
My first question is, what is the difference between the medical doctor and the rehabilitation doctor when looking at these cases?
While both evaluations or exams are similar, they're vastly different because they're kind of looking at two different things. So think of it like this. The medical doctor, their job is to diagnose and treat pathological conditions. And the physical therapist's job is to evaluate and treat dysfunction. Okay? So the evaluation is very, very similar, but what they look for and how they treat are vastly different. So the medical doctor typically will use medication management, pain medications, muscle relaxants, anti-anxiety medications, whatever, et cetera, to treat whatever's going on with them to help calm them down or to relieve muscle pain or muscle spasm, et cetera. The physical therapist, of course, then treats them via exercises, manual therapy, electrical stimulation, traction, active type rehabilitative exercises, with an outcome of let's try to get them back to their prior level of function status. Okay, so high level of function. And the same thing happens with medical doctors, but they're not looking necessarily for function per se. They might, but it's more of just, are they at where they were before the action as far as just their being,
Right.
if that helps.
Yes. Why is it so important that the medical doctor and rehabilitation doctor are on the same page when it comes to patient care?
So there's a large disconnect in that realm. And I see it not only with just the rehabilitation doctor and the medical doctor, it's with all different practices. They're not integrated. So the medical doctor might refer a patient to neuropsychology for their brain injury. And then the unfortunate thing about medical doctors is that patient doesn't see the medical doctor but once every month, once every 2 months. So they don't even know if the patient went to neuropsychology for treatment. And if they did, what was the outcome? What are the chances of the neuropsychologist getting that note to the doctor so they can review it and then make appropriate adjustments to maybe medications or whatever? And so there's a huge disconnect. So all disciplines must be playing in concert together, not only for just appropriate patient care, but also on the stand. If the rehab doctor is opining on their future, what their future looks like as far as impairment wise and their ability to perform work activities or activities of daily living, etc. And that picture is vastly different from what the medical doctor is saying. Well, that's kind of a kibosh to that case or the validity of those experts, right? Because the jury is now confused and the jury is like, well, this guy is saying this guy is saying this. I don't know what to believe.
Right.
So really all disciplines need to function like a well-oiled machine, not only just, again, for congruent patient care to make sure they get the appropriateness of the care they need, but also on the stand to complete a really solid personal injury case. Everyone has to be singing out of the same hymnal.
Yes, I love that.
Yeah.
Such good information, Dr. Poppie. Thank you so much for joining us today for this episode. And if you are enjoying these videos and finding them to be educational and informative and beneficial, please like, subscribe, hit that bell, and you will be notified of future programs here at Personal Injury Today.